Hello guys. So now we shall be discussing regarding the sixth pair of cranial nerve, that is your abducens nerve. Okay. Our topic of discussion will be regarding the abducens nerve. So abducens nerve is your cranial nerve number 6. So let us see what all muscles does it supply. Now this picture whatever I have drawn over here, right? So this is the picture of your pons. So this is the picture of your pons. Now within this pons, there are two groups of nuclei which you can see. Okay. So what are these two groups of nuclei? See, this particular nucleus, whatever you can see over here, is called as facial motor nucleus. Facial motor nucleus. After that, this blue color nucleus, whatever you can see over here, is called as abducens nucleus. Abducent nucleus. Now from the abducent nucleus, whatever this blue color line I have drawn, this is called as your abducent nerve. But important thing you need to know over here is that initially this is how it is present. See here. Initially this is how the structure is present in this way, right? Now if you look here, what I am trying to tell you is that you see this facial motor nucleus. This facial motor nucleus is taking a turn, right? This facial motor nucleus, from this facial motor nucleus, the nerve which is coming, this brown color nerve which is coming is called facial nerve. See, this is your facial nerve. Facial nerve. So this facial nerve is taking a turn around the abducent nerve. As it is taking a turn around the abducent nerve, what is going to happen is that this will create some kind of swelling over here. Just look in the picture, see, it is creating some kind of swelling over here. Wherever there is a turn, that is creating, even at the lower part also here, it is somewhat creating a swelling over here. This swelling that is formed by the turn of facial nerve is what is called as facial colliculus. So this is called as facial colliculus. So what is this swelling? This is called as your facial colliculus. So fine, let us discuss about the facial nerve later on, but now what we need to know is that this artery in the center, you see this particular artery in the center is called as basilar artery. This is called basilar artery. Now basilar artery is having two branches like this, right? So the name of this branch is anterior inferior cerebellar artery. Anterior inferior cerebellar artery. Next, this artery over here is called as vertebral artery. Vertebral artery. Okay, you know, both the vertebral arteries join together to form the basilar artery. So this is called as your vertebral artery. Now what is happening, and by the way, what is this? This is called as a petrous part of the temporal bone. You see, this one is called petrous part of your temporal bone. Petrous part of your temporal bone. Next, just above the petrous part of your temporal bone, you see a blue color shade. This blue color shade is nothing but called as your inferior petrosal sinus. Inferior petrosal sinus. Inferior petrosal sinus. Okay. And what is this structure over here? This is called as your dorsum sellae. This is called as your dorsum sellae. And this green color shade whatever I have given over here is called as your cavernous sinus. Cavernous sinus. Within the center of the cavernous sinus you see an artery. This is called as internal carotid artery. Next, in front of the internal carotid artery you see an oblique fissure. This fissure is called as superior orbital fissure. Superior orbital fissure. Okay. Now let us look at the course of this nerve. So let us start discussing from the starting onwards. So here you have to know that there are two groups of nuclei. One is called as a facial motor nucleus, and next nucleus, this blue one, is called as a abducent nucleus. This facial motor nucleus will take a turn. As it is taking a turn, it is creating a kind of dent on the wall of the pons, that is called as facial colliculus. So coming to this motor the abducent nerve nucleus. This abducent nerve nucleus is ipsilateral, not contralateral like your trochlear nerve. Okay, if you remember, you see the trochlear nerve here, the trochlear nerve nucleus on the right side, from there the trochlear nerve arises and goes to the left side one goes to the right, but here it is ipsilateral. So this abducent nerve is passing between two arteries. One is called vertebral artery, another one is called as anterior inferior cerebellar artery. It is passing in between the two arteries, and this nerve is going directly to where? It is going directly to the tip of the petrous part of the temporal bone. And then along with that, actually this nerve is passing along the tip of the petrous part of the temporal bone, where which sinus is present? Your inferior petrosal sinus is present. Next important thing is that you can see a green color line, that is, you see this green color line here? This green color line is touching both the things. One is your dorsum sellae and your petrous part of the temporal bone. So this ligament over here is called as your petroclinoid ligament. Petroclinoid ligament. Okay. Now, because of this ligament, you see there is a canal that is formed over here, right? So this canal over here is called as Dorello's canal, right? You see this canal, this particular canal over here is called as Dorello's canal. Now, what is passing through this Dorello's canal? There are two structures that are passing through this Dorello's canal. One is called as your abducent nerve, and along with the abducent nerve there is another sinus that is passing, that is called as inferior petrosal sinus. So these are the two important structures. So what are the structures that are passing through this canal? One is called as the petroclinoid ligament, another one is called as the inferior petrosal sinus. Now this abducent nerve comes down all the way, and it is passing through through the cavernous sinus. Cavernous sinus exactly below or inferior to your internal carotid artery, and then it passes through the supraorbital fissure and finally innervates a muscle here, and the name of this muscle is your what? This is your lateral rectus muscle. Lateral rectus muscle. Okay, so again you just have to remember this very important thing, that SO4 LR6 R3. SO4 in the sense the superior oblique, SO4 in the sense superior oblique is supplied by the fourth pair of cranial nerve. Next, lateral rectus is supplied by the sixth pair of cranial nerve, and the rest are supplied by the third pair of cranial nerve. Okay, so lateral rectus is to the sixth pair of cranial nerve. That is the nerve that is supplying to the lateral rectus. So this is all you need to know regarding the abducens nerve, guys. So thank you so much for watching my video. Goodbye.